on Channel 4, the local station. This is Look Local.
Thank you so much for being with us. I'm Karen Adams, and this is Look Local, the place where we celebrate the best and the brightest of where we live. We do that by reminding you, if you're looking for someone to help when it comes to business, it's always better to look local. This week, we're featuring SEVO-Med. If you're an animal owner and your pet gets diagnosed with cancer, this is definitely an option to explore. Jacksonville Country Day School, a leading private elementary school in Jacksonville. We're going to see what sets them apart. The Jax Bridges program, a division of the Jacksonville Chamber of Commerce, helping new businesses get a start. And 904thin.com, which is a Nutrimos program. You're going to find out how that works. But we begin today with SEVO-Med and Dr. Jennifer Locke. Dr. Jennifer Locke is a medical oncologist treating animals here in the area who are diagnosed with cancer. So welcome to the show.
Thank you.
Tell us a little bit about SEVO-Med.
Well, SEVO-Med is a specialty clinic here in Jacksonville. Our primary focus is on treatment of cancers in dogs and cats and other species, as well as internal medicine specialty for patients who are battling diabetes or chronic kidney disease or heart disease.
Now, when I initially met you, it was because I had one of my family members, my old girl, Arla Mae, who was 16 at the time. She was diagnosed with cancer. We have a picture of her. And this is, this was early on, probably soon after her diagnosis. Right. She was diagnosed with cutaneous lymphoma. What is cutaneous lymphoma for those that may not know?
Yes, you're seeing here that that's a good representation of what cutaneous lymphoma is. This is one of the types of the most common cancers that we deal with. You can see that cutaneous lymphomas are these lumps and bumps that develop on the skin. We can see lymphomas, as well as other types of cancers, develop in much the same way. And so it took a biopsy with Arla Mae to make that diagnosis, as it does for a lot of our patients.
The one thing that's interesting about that picture with the bump, if you can go back, Harold, and show the first bump, that was right before she was diagnosed. So that lump was quite huge. And then just 2 weeks after she started chemotherapy, then that next picture, and that was only 14 days afterwards, you can see what happened to that bump. It started to literally dry up, just like all the rest of them that she had more or less on her underbelly.
Sure.
At one point, she was almost in complete remission.
Correct. And that's our goal. And more important than achieving remission of the disease, although that is our goal when it comes to the cancer treatment, is to make sure quality of life is of the utmost priority. And you experienced that, obviously, with Arla Mae.
I did. And, it was one of those things where at least I got to spend another 6 months with her after the initial diagnosis. So for that, I will ever be grateful for you. And so my boss, Sam, says, now, I don't want to see any misty eyes out there, so I can't cry. All right, now this is some of what's going on behind the scenes in your lab. Tell us what we're seeing here, Dr.
Sure. Well, this is one of my wonderful nurses, Kathy. She's mixing up chemotherapy. Chemotherapy is one of the primary things that we do in our clinic. And you can see here they're in all their special garb to protect them from the effects of chemotherapy. But you can see our patients who are getting chemotherapy have nice, beautiful coats. They take their treatments very well, and we give them lots and lots of cookies at the end of their treatments. And because of that, most of our patients are just as cooperative as seen here when they get their treatments. And this is our internal medicine doctor over at our San Pablo location, Dr. Trina. She's actually doing an ultrasound. And so these are a lot of the things that we do with our patients on a day-to-day basis. It's obviously something where they have quite a good reputation with rapport with us, and a really great positive experience with us, and that's what's important.
And there's different types of chemotherapies, and like the one we saw there with the lab and having the injection, that was totally different. My dog was given just a pill once a month.
Right. There's a lot of different ways in which we provide these treatments, whether it's intensive chemotherapy, injections, pills, or even going back to things very simply, pain medications, palliative care.
Oh,
there she is. So that was obviously Thanksgiving. She got her little pilgrim hat.
You always give him hats. When she came out with that on, I was like, oh my gosh, she's got a pilgrim hat on. And here's another one. This is something you guys just kind of do for the pet owner. That makes it kind of cute.
Well, yeah, these are some of our graduation hats. So this is absolutely a family story. So something we want to make sure that the families are involved and are able to celebrate with birthdays and graduations and any other special milestones that they may have during the course of their treatment.
So it's just kind of nice. And we also have a couple at the end that I want to show you. These are some of the animals you may not expect, but I guess ones that you've treated. One is a goat and one is a mountain lion, or it's a big cat. It's a big cat of some sort.
Yeah, so there's Nell the goat. She actually developed a certain type of skin cancer, squamous cell carcinoma, and there's one of our kitties from Caddyshack that came in for radiation therapy with us. So again, lymphoma, same as our LeMay had, affected a tiger. So, we definitely get to see some of the greatest. We worked with Jacksonville Zoo a lot and a lot of other rescue groups in the area.
You know, I find a lot of people, when I know my dog was undergoing, you know, the treatment for the cancer, people are so shocked. They don't realize, you mean dogs can get the same kind of diseases that people can? And the answer is yes, very oftentimes, correct?
Absolutely. There's a lot of crossover between the behaviors of certain types of cancers that people get and dogs and cats will get. But again, the big difference when it comes to cancer treatment is making every day the best day it can possibly be, without side effects, without feeling ill, so that they can continue to live their life, whatever that may be, couch potato or
going to the beach,
chasing the tennis ball, mooching for food, all of those things.
We know that. We know they're feeling at least better when they do that. The other thing I want to say in parting is that oftentimes animals take the chemotherapy much better than humans do. They don't get sick like people do. For some reasons, I guess their systems just tolerate it better.
Absolutely. They tend to be a lot tougher than I think we are, but at the same time, our doses of chemo are much more conservative so that we are able to make sure quality of life trumps everything else along the course of treatment.
Well, SEVO-Med did a wonderful job for us, and I'm so glad that you're here today. If anybody has any questions, you can look them up right there on the web along with their telephone number. Dr. Jennifer Locke, thank you so much. And you're at the Beaches location.
We are at the Beaches location.
All right, you have a couple ones. So go online and you can see all of their different locations. Thanks again for coming in.
Thank you so much.
You bet. Coming up next, we're going to take a close look at Jacksonville Country Day School and see what makes it a premier school to put your children. But first, this Friday, the 13th, Michael Carbonero will be live in Jacksonville. He'll perform outlandish magic tricks while getting the audience involved at the same time. For more information, you can go to the web address on your screen.